Having a baby brings about big changes to a mother's body, brain, and life. Tiredness and stress are an inevitable part of parenthood, but some mothers deal with much more serious challenges too, particularly during the perinatal period. The perinatal period is loosely defined as the year leading up to birth plus the year after it. In the US, 1 out of 5 women will struggle with mood and anxiety disorders during this time. In Utah, that number is closer to half. In general, perinatal mood disorders are underdiagnosed and undertreated, and the consequences can be devastating. Of depressed perinatal women, up to 1 in 5 may have thoughts of harming themselves. Untreated depression or anxiety during pregnancy also leads to higher rates of premature labor, cesarean sections, and issues with the child's development. So, it's vital that red flags aren't missed to ensure moms receive the care they need. The good news? These mental illnesses tend to respond well to appropriate treatment. But right now, only about half of affected women go on to receive treatment. And of those that do, very few stick with it. Some may dismiss their symptoms as the new normal or even the baby blues. Stigma around mental health, lack of access to care, and a fear of being seen as unfit are also significant barriers. So, what more can be done? Here are a few simple things health providers can do to help. First, screening. No one can tell the mental health status of someone simply by looking at them. And while low mood and anxiety are common mental health struggles, it's vital that these symptoms are properly assessed. Second, by openly providing education and awareness to pregnant and postpartum people in Utah, we can help create a safe space for people to openly ask for help. Finally, support. If a mental illness is present, providers can help by either administering treatment or seeking immediate help for their patients to minimize the impact of these conditions as soon as possible. Now, we know you want to help, but we also know how busy you are. That's why we created the Utah Maternal Mental Health Toolkit to provide you with straightforward information on identifying and treating perinatal mood disorders. We hope that this toolkit and the next few videos will make it as easy as possible to implement these new protocols into your practice. Remember, when it comes to mental health, we all have a role to play. And for many, you are the first link in that chain.